All right, so now we are recording. Welcome to our first ever sports care panel talk discussion. This was set up with the intention that PRN athletic trainers could come in, listen, learn a few things about sports care, who our sports care reps are, what you guys do, how you help, how we help you, and how that correlation works within our BSW umbrella, since PRN is covered by sports health. Did you guys want to go in any particular order? Do you want me to start with some questions? What is your preferred method of interrogation?
Do you want to just do an introduction and have everybody introduce who they are?
Yeah, that sounds good. I'll let you go first, Corey.
Hello to everybody. For those of you who have not met me before, my name is Corey Smith. I have now worked for 1 year with Baylor Scott & White Sports Care. And so those of you who have known me from any of my work before, I was working at Plano ISD most recently before coming on board with sports care. And in the past, I worked with Texas Health. I've been really enjoying my first year and really appreciate Nicola for putting this together. I guess the other thing is that I am up in Plano and McKinney.
Thank you for adding that. Mindy, do you want to go next?
Sure. I am Mindy. For those that don't know me, I have the Rowlett, Rockwall, East Dallas, South Dallas, and everywhere east. So I get a lot of the little schools in like Wiley and Lucas, all the way out to Commerce in Greenville. So I'm going to be about a year next week. September 1st will be my year. And I have not ever been in the high school setting before. So I am learning things as I go. And I appreciate any feedback and help from any of y'all out there.
Thank you. All right. Let's go with Todd next.
I'm Todd. I'm in Fort Worth, assigned to Baylor All Saints Hospital in Fort Worth area, and now also Arlington and Bocia for who knows how long. Hadn't been told. Maybe permanent. Who knows? And I'm in my 6th year with sports care and retired with 28 years of high school. And been loving working for sports care ever since, but still trying to learn something from you young bucks. How about that?
That's good. We like that. I know we have a lot to learn from you guys. JD, you're going to be next up on our list.
Yes, I'm JD Shields. I'm the sports care rep in Waxahachie region. I've been in outreach, athletic training in the Metroplex for 16 years now, 13 of those full-time. Some of you may know me from my previous tenure at Texas Health Sports Medicine, and I am still a toddler with sports care. I think I'm going on 22 months.
All right, wonderful. Well, thank you guys all so much for being here and with talking with us. Let's start with an easy one. What is sports care and how does it relate to our PRN athletic trainers?
I'll jump in. I'll say the phrase we say a lot is patient concierge, a phrase that I latched onto in one of our meetings a couple months ago was we're here to help eliminate confusion.
Okay, that's a good answer. Would anybody like to compound on that?
Just basically doing. Oh, go ahead.
I was just going to add that we may not always have all the answers. I know for sure that I don't, but the idea hopefully is that we know somebody that does have the answer so we can help make that connection for you. So there's really no question that's silly or stupid for us, because if we don't know it, we can hopefully find somebody that gets us in the right direction for you.
Yeah, and basically for athletic trainers, we just try to help take some off their plate, getting a hold of doctors and making sure that we help get them to the right doctor, make sure that they take their insurance, that sort of thing.
Okay. So if I'm the athletic trainer on site and I have an injury and I submit an injury report within your area, do you have access to that? Do you get to contact those patients, whether they follow up in the hospital or they're going on to see their athletic trainer or even another physician within our system?
Yes, we do. We will see that injury report, but it might not be in real time. It just depends on when they submit it and when it gets forwarded to us. So if you're an athletic trainer and you're working in my area, I mean, a text or a phone call, whether it's Saturday, Sunday, Friday night, whatever, a text or a phone call, we might be able to help facilitate getting them to an emergency room, call the emergency room ahead. We can do that in real time if you'll give us that opportunity.
Wonderful. Is there a preferred method of communication? Do you prefer phone call? Do you guys prefer text? I know I have all the contact information to send out to our PRNs and our viewership. But like for myself, I know if I am actively at a sporting event, it's a lot easier for me to text you necessarily than be on the phone with everything going on in the background.
Yeah, however works best for what that situation is. I think that we all have lots of different circumstances where we could probably tell you how it was good in one way versus the other, right? So sometimes a phone call can be best because that allows you to be able to communicate and do things. A lot of times I'll ask, okay, well, after we get off the phone, just text me the information, because that's the way that athletic trainer likes to document, is to be able to put it in a note or whatever on their phone. And so then texting that information allows me to be able to do it. Maybe I'm working an event the same time, and so a text is really going to be best for me to be able to hand that off. And as you talk about those things that we're doing to try to make things as easy as possible for the athletic trainers out there, sometimes that means we're handling it before it goes to the emergency room. Sometimes that means we're handling it after it goes to the emergency room. Sometimes we've got to handle it to make sure it gets to the right doc or to physical therapy. So far today, I have handled a physician visit, an emergency room visit, and a PT visit. And, all of them were unique in different circumstances.
Awesome. So
Nicola,
go ahead.
the only note I'd like to add is that whichever way you can get, for me personally, whichever way you can get in touch with me, shoot a text, and then if I don't answer and it's urgent, then call my phone and hang up or stay on the line. Yeah, it's just whichever way we can get the communication piece together.
Great. I think that clears up a lot for our athletic trainers. I know sometimes the thought is that you guys as sports care are there only for those injury moments. I know Mindy mentioned that if we have a question or we're trying to find something or a problem, lots of times you guys can be that liaison for our patient and for the athletic trainers. How does that fit if someone is at a high school or at an industrial setting and they might be looking for PTs to come in and help with physicals, or a specialist, or even, bracing funding for one of their athletes? Do you guys deal with any of that?
Yeah, I mean, I've done all of that stuff, exactly what you said. I think we've all set up and helped with physicals at one point or another. We can help coordinate doctors for those, and PTs that come in and help with those as well. You know, a lot of our PTs are willing to go out to the industrial setting or the school. Sometimes they'll do just injury screens for some of the teams. They'll do a whole team and, you know, maybe give some feedback about ways they can help prevent injuries for the season. So there's all different sorts of ways that we can be involved. We've got bracing, you know, I think we've kind of started to create a relationship with Don Joy Orthopedics, and, you know, we've got resources for, I've kind of made it my mission, I guess, for the underinsured or uninsured kids as well. So, you know, we try to find places for them to go, even if we can't find something within Baylor Scott and White, just any way that we can help get those kids taken care of.
Awesome. That's nice to hear, because I know there's a lot of that out there, and sometimes it's just a matter of knowing where your resources are and who is someone that you can ask for those resources, especially with a lot of our staff being new athletic trainers. As far as relationship building for our athletic trainers, if they're trying to create a situation where we could possibly come in as a contract or be pulled on in more of a higher capacity, is that something that sports care would be able to do to help out, come in and talk to athletic directors and people of that nature?
I'll take that one, and I'll say yes, and I'll kind of loop it back to your previous question, where yes, we go in and meet with those organizations, whether it be a school or a club, and basically just ask them what their needs are. Ultimately, our goal is to create a partnership where both sides win, and then we can meet the needs, and then the business takes care of itself. That's, I'd just be repeating myself, and I'll just go ahead and say it. We do a needs analysis, and then what can we do to meet those needs? And I don't have all the answers, so I lean on my other sports care colleagues, and I'll lean on the athletic trainer that brought the lead to us. We lean on our entire community of where can we go next to meet this need.
I always tell everybody that I'm in a constant state of discovery. I'm trying to be able to figure out as many things as I can that are out there in the community that are going to be able to help whenever we identify and hear about those needs that someone has. I want to be able to bring those together. So, you know, I'm always wanting to listen to something that's going on, a new program, what an athletic trainer at a school's doing, right? If I can learn from them, from just sitting down in their athletic training room and having a conversation and try to be able to figure out something that's working great for them, can we take it to somebody else and help them out in some way? You know, knowing what programs we work with, Living for Zachary up here in Plano, which is a great program. Been able to tie in some of our smaller homeschool organizations into being able to get an AED, right? Something to really be able to help them, that just being aware of those programs and those opportunities is, again, mutually beneficial. They're out there to help, and we want to be able to bring those together.
Awesome. What else do you guys do? Because so far it sounds like you do a lot of everything.
Well, I've had Baylor physical therapy places say, how could we get with the athletic trainers? So I said, well, I think I can help do that. You buy the pizza and the cold drinks and put on a little dry needling demo, and I'll get your athletic trainers from your high schools there.
Awesome. That's a great idea. In fact, I am working with JD right now for a orthopedic discussion for Sideline that will be presenting out for our PRNs and other athletic trainers that want to join into those. So I know firsthand, working with you guys, we can create CEUs together. And for my PRN athletic trainers and full-times, you know, if you have contacts with physicians or organizations that would like to help get us together or want to see more of us in one spot and we can offer CEUs, that makes a great collaboration for all of us.
And I think the other part to our jobs probably is the doctors and the physicians that, you know, we get to chat with them a lot. So we make sure that that's one of our priorities too, is making sure we keep them happy. So that way, when we call them, they'll see our kid today that we need, and they don't have to wait on a busy schedule. And, you know, hopefully we can get those kids streamlined and in quickly.
As a parent, you know, that's one of the greatest things, because you don't want your kid to suffer for longer than they need to. And plus you want that reassurance that everything's going to be okay and they're getting taken care of. So I know the other parents out there really appreciate that. Do the physicians and the groups that we work with, are they offering telemedicine right now with everything going on?
They are, and you know, and particularly, it varies from office to office depending on what the needs are. Right, you can't get an X-ray, can't get an MRI via telemedicine, right? But there are lots of opportunities that are out there with our providers, and it really depends upon the injury. Can we do a telemedicine for the follow-up? Can we do some of those things to be able to have that line of communication? And we're good about communicating with those specific offices to have those opportunities. I know for our concussion visits, in many cases that can be an option, depending upon the severity and what's going on. Which has been helpful to be able to expand our network more across the Metroplex. With Baylor Scott and White, we've got a few concussion physicians that are across the Metroplex, and then we also have our hub that's up at the Star in Frisco. So having telemedicine as an available option has really helped to expand the coverage for which we've been able to offer.
And also the primary care doctors are doing a lot more through the My Baylor app. I mean, you can get a hold of a nurse, you know, get a script changed, that sort of thing.
Okay, and the My Baylor app, is that one that you would download after you've become a patient? So if you've gone to the ED or if you've seen one of our PCMs in their clinic that are Baylor physicians?
A lot of times your first visit to your primary care doctor, the nurse will pull it up on your phone and show you how to use it.
That's awesome. I'm going to have to look into that because I personally haven't used it yet, but I like that and that transparency to be able to communicate with our physicians and on our own personal care.
You can, I'll make a shameless plug right here. Nicola, you can download that app prior to becoming a patient. And one of the best values of that right now is you can schedule a COVID vaccine shot using that app without being a patient.
Okay, awesome. That is a great resource. All right. Let's
Through
see.
the app too, Nicola, it allows you to be able to not only communicate with the physicians, but find physicians.
Okay.
As athletic trainers who, you know, we're out everywhere. That's what I use it for, right? If I'm looking for contact information for an office and I need it quickly, oftentimes I'll screen capture some of those resources and share them with our athletic trainers to be able to help facilitate some things to make it happen quickly. It has been a great resource to be able to have, and you know, we want to make things as easy as possible, right? And so that's been one resource for us to be able to do. And you can go on and find the, you know, it's my BSW Health, and, you know, convenience is key.
Yes, definitely. And so being convenient, I know you guys are kind of spread out all over for the DFW Metroplex. Do we have hospitals in all of these large metroplexes? Do we have urgent cares? Do we have PT clinics, primary cares? Kind of what is that makeup for each of your regions?
In Fort Worth, we have a little minor emergency clinic. Stays open till like 8 o'clock, that sort of thing.
Okay.
Yeah, down in Waxahachie, we've got the urgent care is actually in Midlothian. At the hospital, we've got the ED. Over in Mansfield, we've got Baylor Emergency Hospital. And then I've gone out and made friends with standalone ERs, just to develop communication, especially in our current state with the COVID cases. I've talked to my athletic trainers about not sending orthopedic needs to the ED. And if they can wait for an office visit the next day, we'll make sure we get them in a timely manner. Or if they can't wait, I'm finding them other resources that can accommodate so that we're not overrunning the ED.
That's a great point. With COVID and with the EDs being full in some areas, is that a resource that you guys have to be able to point our athletic trainers and our parents in the right direction if there's one ED that would be faster than another, would get them in or have less exposure risk?
Yes, and that falls right in line with something I had just last week. One of the perks of calling us before heading out to the ED is that the closest emergency for my area happened to be Murphy, which is one of our standalone ERs. But when I called them and said, we're sending this kid in, I was told we've got 1 million COVID patients in here right now. I wouldn't recommend sending somebody in here. So that allowed me to call Wiley 5 minutes down the street. And they said, we'll get them right through. No worries. We don't have that many COVID patients. So that helps that mom out a lot. She was already dealing with dad being quarantined for COVID. So she was more than happy to not go to an ER where they were upfront and told me that they had a lot of patients with COVID in there. So we could speed it up that way.
I think that's the greatness of the circumstances where we build those relationships as much as possible so that when we do reach out, then they know who we are and they can give us an honest assessment of what's going on. And we know the right phone number, the right contact, the right person to be able to be in contact with. Today, that when I had an emergency room visit this morning, that was let me call ahead and let me verify that we can be able to do that. Okay, things are not busy because of how early in the morning it was. And so then it was a viable option. In the evenings, that's been tough recently with COVID patients and being able to do things. And, in Collin County, where I am in Plano and McKinney and Frisco, we've got a hospital in each one of those. In Frisco, we've got Baylor Frisco and Baylor Frisco Centennial. We've got the Star. We've got an urgent care that is in Murphy, which is on the, the edge there of East Plano. We've got Aubrey has a standalone emergency room. We've got so many resources. Being able to help navigate that to make it as streamlined and as efficient for everybody. That's really, what we're trying to be able to do. Right now, we've had some fluctuating hours with our standalone urgent cares and our urgent care offices. So that's affected things. And, we try to be able to help navigate those hurdles as quickly as we can, trying to make sure that we find the right resources. And just like what JD said, sometimes if we can delay that, depending upon the level of care that's needed, and get someone in with a physician's office directly rather than some of those resources, that's really where things are headed right now, particularly with COVID cases.
And I'll put my Arlington hat on, and Arlington has standalone there at Boscia. And Boscia, of course, they're an orthopedic hospital, so they don't deal with hardly any COVID stuff. So that's a big plus about that. And it's kind of right in the middle of the Metroplex. So if any of you guys need anyone that doesn't have anything dealing with COVID, or they don't want to have to worry about exposure, then give me a call and send them to Boscia.
Great. That's awesome, because that really helps everyone to close that line of care. Last question that I had on my list for you guys. We have a lot of PRN athletic trainers that are going to school. They're doing other things. They're trying to advance themselves as athletic trainers. And now we have the orthopedic certification, which requires ortho hours and exposure to different doctors in different settings. With your vast knowledge and that continued commitment to our physicians, would that be something that our athletic trainers could reach out if they're in a certain area and they're looking for a certain specialty to get face-to-face with a physician that maybe they wouldn't have had the opportunity to do before reaching out to you guys?
Yeah, I mean, I'll field that one first, but I've had an athletic trainer this summer in the high school setting that is planning on going to or applying to PA schools next year. And so she just wanted some, PA shadow time, volunteer time. So I was able to set her up with one of our doctors who has a PA. She got to do some time with the doctor and some time with the PA. With COVID, we couldn't get her in the OR right now, but she could at least get the office time and experience that way. So that was helpful to her, I think, and will help her on her application as well, because she's got those hours somebody else might not have.
Yeah, definitely. Especially now with COVID. I know we've had a lot of people at the STAR that were really grateful to be able to come in and observe from the physical therapy side. But with the numbers spiking back up, I see that being limited a little bit more as we move forward. All right. That's all the questions I had from my side from athletic trainers that had chimed in. Do you guys have anything specific that we have missed out or that you want to touch base on? Yes, Corey.
I will just jump in and I will say that we're all wanting to build better relationships with the athlete trainers, not only the ones who are working PRN for Baylor Scott and White, but for the community. And when it comes to the athlete trainers who are working PRN, we want you to think about when you are filling out an injury report, when you're doing it at your injury evaluation and you're trying to be able to do the best that you can on site, taking care of kids, taking care of an injury, being the people in the trenches as we all have done. We want you to think about us as being the athlete trainer who's sharing the training room with you, right? So if you're sharing the training room, your documentation, what you're doing, what you're saying, how you're communicating, we want to make that as efficient as possible. So think about that you're writing your injury evaluation for us to be able to read, right? If we can be able to pick up and know exactly what you saw, then that's going to be able to help us when we're talking to the family later to be able to follow up on the great work that you've already done. That's going to help us when we're trying to be able to get them in with a physician, following up on what you've already seen. And we really want to close that loop and be able to bring it back where we can communicate and let you know, hey, this is what we saw. This is what the parents said. They were super appreciative. You really helped out in that time. You got them directed exactly where they needed to be. I've been fortunate enough recently where I've been able to go to quite a few of our meetings where we have concussion policies with the leagues, like Girls Classic League with AT&T High School Hockey. Same thing goes for there, right? Where if you're doing our brand new trifold, our brand new form, our on-field findings form, which is a great resource. It is on the When I Work app. If you need those, let us know. We'll bring you the forms. We'll meet up with you to be able to see you in person, to be able to have the forms. And if you take a picture of that form to be able to fill out your injury report, let the form go with the parents. It's got information for them for home care. The parents, we learn they don't take in all of everything that we're saying at the time of, because we're so focused on what the injury is and what we're doing to try to take care of them. No matter how much we try to be really good communicators to them, it's hard for them to consume all that information, especially if they don't have a healthcare background. Give them that recorded document that you've got that has information on it. You take a picture of it, then you can be able to complete your injury report. Text that to us. Let us be able to pick up with everything that you've done, and then we'll be able to navigate things for them to the best of our ability to meet up with the best of your ability doing what you've already done, which is evaluating that injury.
Awesome.
Yeah, I want to pick up on what Corey was saying and just say, recently I've had two high quality examples where I've had, well, speaking of one case, mom is asking me, do you think I need to go get an x-ray now, or am I going to be wasting my money? Should I go see a specialist? And because of the quality of the injury report that was written, I'm able to pass that information along to one of my physicians to consult with. And then the decision was made, yes, we do need to come in and see a specialist, alleviate mom's concerns. But it just expedites the whole process, and it increases the quality of communication, and it makes the office visit easier for the physician. And then the other thing that I want to say is, as I said, I've worked in outreach for 16 years. I know that sometimes when you're out on the field, a parent might tell you, oh, we know where we're going, or, oh, we don't need your help, or, oh, we're good. Please go ahead and write up the injury report, make the documentation. That gives us the opportunity to call and interact with a parent. And I just want to let you know that you'd be surprised at the number of times when the parent's plan falls through and they need our help. And if you don't do that injury report, then we would never have that opportunity to take care of those kiddos.
And just a couple of quick things, very important. Make sure we get a working phone number and let that parent know that one of the reps will be calling. Otherwise, they'll never answer, never call back. They think it's a telemarketer. Think we're trying to sell them insurance.
Your car warranty is about to expire.
Yeah, your car warranty is about to expire.
That's a great point, because I know sometimes we get a little overwhelmed by talking to the parent and trying to get the athlete off the field and make sure everything's taken care of, that sometimes we miss those little tricks and those necessary moments. Parents' email, parents' phone number, parents' name, all great resources. Do you guys have to necessarily have their full address? Trying to think what's else on there that maybe we miss some from time to time.
I think that's helpful, just from the fact that it helps us see who should actually be following up with that kiddo or that mom. Because, if we don't have the address, it might be a little closer to Arlington, or it might be a little closer to Dallas, or whichever. So that's easier for us just to make sure. And we're a little more streamlined that way, to have the address. But one more little thing to add then that we help with is just that, from my perspective anyway, if you're out somewhere and you need supplies that you can't get to Kendall or Lydia's office to get them, my trunk is always fully stocked. So, I'm a phone call away. If I might not be able to go immediately, but I can get stuff to you. We can arrange a time to get supplies as well. So that's just kind of one of those extra little silly things that people don't think about, because their office is kind of far for some people. So if you're in my area, at least I've usually got supplies for people as well.
Great.
I know that when an event might be happening because of Arlington Soccer Association, they may have come from any of our areas to be able to play there, and vice versa. So sometimes parents may want an emergency room closer than home. Let's say, little Johnny has a broken collarbone and we're trying to be able to navigate and figure out exactly what's going on and where we're going to go. And they say, all right, well, it happened in Arlington, but they'd like to go to Plano because that's closer to home. And that's where, dad is. And they've got to, all these things that they may have to navigate. So we all communicate with each other to be able to handle those things. So, sometimes you'll hand it off to us and we'll hand it off to another one. We'll do those things to be able to work together and just try to make it as seamless as possible. So more information that you can have in that really does help us to help them.
Awesome, guys. Thank you, Mindy, for bringing up supplies. I also have supplies in my trunk, but you're right. It's sometimes hard. And sometimes even athletic trainers will reach out to me for supplies, but I'm not in that area because I'm in someone else's area doing work. So it's good to know that we have other resources with you guys as well. All right, I'm going to do a screen share and just kind of go through our contact stuff real quick. Let's see if I can do that one. Maybe it'll present for me. Hey, there we go. All right. So these are the contacts with the QR codes that I have for each one of you guys. I'm just gonna kind of flip through. If you see anything on there that we need to change or alter, please let me know. I'm going to be sending this out to all the athletic trainers that we have on staff here when we send out the video and the updated information.
That is great. Thank you, Nicola.
All right, thanks guys. Well, thank you so much for meeting with us and for being willing to be open and talk and for all the great things that you do. Hopefully we've learned a little bit more about sports care and how we can make your jobs easier, because I know you guys are making our jobs easier. All right.
Thank you very much. We appreciate this opportunity. And if there's anything that anybody sees that they need or have questions about, please reach out to us.
Nicola,
Yes, sir.
thank you for putting this together. Really appreciate it.
You're welcome.
Yeah, thanks.
You're welcome.